emergency room, it's vibrant. Even on the days that are hard, it's vibrant, it's alive, and it's tangible. A lot of days it's kind of a slog. It's the day in, it's the day out. You see kind of similar complaints. But the thing that makes it different every day, which is the thing that I love about it, is the patient. It's the feeling you get where you can see somebody came because they had chest pain, but understand really they were afraid because maybe they had a family member who had died suddenly. And what we can offer them is solace. I identified as queer very early. I think my first conversation with my mom was when I was 4. But then I sort of officially came out when I was 11. It was a hard time. And where I found my safety and my comfort was in the theater. I would show up at the local theater dressed in all black and just be like, can you put me to work? Is there anything I could do? And slowly built my way up and eventually went to a high school that had a huge performing arts program and got very involved there. And decided that the things that I really loved were stage management and lighting design. When I finished college, I worked for the Santa Fe Opera for a number of years as initially an intern and then assistant master electrician for a bunch of seasons. My second or third year of doing that, my brother had a catastrophic stroke. I flew home as an emergency and I saw my brother, who was always bigger and who was always just a force of life, laying in an intensive care bed, unable to move his left side and unable to speak. I went home back to Chicago after I was there for a few days. And I remember sitting in his room and noticing all these people that came in, and everybody had something to offer him, some help. And I had nothing. I could just sit there and watch, and it really impacted me. So I took an EMT course, I think it was a 6-week training course, and I talked myself into a job that I admittedly likely did not deserve at the time, as an emergency room technician in a very busy emergency department in the city of Chicago. I started to learn to see people, to know when something didn't look right, and I knew to alert the nurse or the physician. And over time, I decided, like, this is the thing for me. So once a week, some older person would say to me when I would go to introduce myself as the physician taking care of them, you know what? You look like Ellen DeGeneres. Finally, it dawned on me that that was their way of finding some common ground with me. Initially, I thought it was hilarious, and then I took it to be actually something so incredibly valuable, because what that says is that people are able to interact with me knowing that maybe I'm different from them or maybe they don't agree, but they're still willing to interact in a way that's truthful. And at the end of the day, I think that's all we can ask for. Having gone to a number of Pride celebrations, when you're at these celebrations, there's a oneness and a togetherness and a shared experience. But I think having safe spaces where we can unite as a community and recognize the beauty in one another and in ourselves and celebrate that is, I think, what Pride boils down to.